I talked to them about wound care, and Luke had bed sores, and he had a huge bed sore on his coccyx, and he was getting 2 more. And, I saw when the nurses changed him and all, and they took pictures all the time, and they showed that 2 more were starting. So I asked for Dr. De Leon, who was in charge of the people with pressure sores and things, to come up and look at Luke. Well, this doctor said there's no need for her to come up. That's just, that's nothing. So it happens to all patients. And then, of course, his trach was raw and green and everything. We were just having so many problems. So I went to the administration. I told them all of this, and I told them that Luke needs a neurologist. I want a neurologist in there. I had gone back over to the hospital, talked to Luke's neurosurgeon who had put the shunt in the first time, and Dr. Michaels said that shunt should have been put in the day he arrived at BSH, or immediately thereafter. Well, it hadn't. That evening, a lady came to visit me in Luke's room, and I had never seen her before, and she just came in and wanted to know if I was happy with the hospital, and I said yes, I was very happy. And she asked if there was anything that I didn't like, and I said, well, I don't like his doctor, and I'd like to have a new doctor. And she said, so there isn't anything the hospital has done to make you upset? And I said, no. They let me shampoo Luke's hair. They let me brush his teeth. And they've trained me how to do that with suction. They also trained me how to change on his trach, how to change the gauze, how to clean it, how to put a new band around his neck. They taught me how to turn him and how to prop him up with pillows and things like this. I said, I just love it. I mean, the nurses were so wonderful. They're so kind. They always said, if I'm here, I want you to take care of me. And I would give Luke pedicures and things like that. They were just wonderful, and the respiratory therapist was wonderful. And so then she asked me, she said, well, would there be any reason that you would have that you would be unhappy with the hospital, or that you would want to, she kind of worded it in a way, not exactly to sue them, but if I would have any adverse interest in the hospital and all that. And I said, no, not at all. I said, that it was just that I wanted Luke to see these specialists. So she left, and a couple days later, this was around the end of April, on April 15th, a hearing was held. Actually, the hospital called Landy up to have him come to the hospital. When Landy came up to the hospital, they told him that she is someone we need to get under control because she's a lawsuit waiting to happen, and you need to go and get temporary guardianship of Luke. And so Landy did that day. He went back to Tyler. He filed for temporary guardianship of Luke. Now, I had no idea. The day he filed for temporary guardianship on April the 15th, Luke was actually in a standing frame for 18 minutes. He was up in his wheelchair. He would sit there for 40 minutes to an hour at a time. I was allowed to take him outside where the garden center was, and I could just wheel him around and show him the flowers, and he would laugh, and he would tell me yes and no. He could voice, and you could tell. I always told him his expressions, like that expression was just the little, that means he was in pain, or when he gave me that little Elvis grin, and that means he was happy and he was comfortable, and so we had our way of communicating. I got to do a lot of things with Luke up there, and he was doing great in rehab. The nurse had taught him how to say, "Hi, Mom," and to surprise me one morning when I went in. And of course, that was just his first words, and it really, really touched me, and it was really precious. And she just, and of course, in therapy, they would say, "Luke, take your arm and put it up on your chair. Take your arm." And Luke would take his arm, put it on his chair. He could wiggle his toes for them. He could follow commands. We could tell him to throw the frisbee. We put the frisbee in his hands, and he could just take and drop it. And he was just progressing wonderfully. Well, on April the 28th, I was with Luke, and I asked who I should talk to, because I really wanted another doctor in to see Luke, and they referred me to this care coordinator called Janice. So when I went and talked to her and said, may I have set an appointment with you and talk with you about getting a new doctor for Luke? I don't feel comfortable with this doctor at all. Well, she said tomorrow at 11 o'clock. Well, when I the next morning I was there with Luke, and it was a couple minutes to 11, and I said, well, and she was up there at the nurse's station. I said, well, are you ready? And she said, can't you tell time? And I said, oh, okay, because it was 3 minutes to 11. So I went back in Luke's room, and about 12:30, she came in with another lady and asked me to go up to the office with them. And so I went up to the office with them, and I thought we were going to discuss about the doctor and who I wanted to be Luke's doctor. And when we got upstairs, she told me to sit down, and they handed me a piece of paper, 2 pieces of paper, and they said, Laney is now the temporary guardian of Luke. And I just was so dumbfounded. I was like, well, what exactly does that mean? And she said that you'll not know anything medical about Luke anymore. You will have your visitation hours set. And I just started weeping. I was just crying. I said, how can this happen? I'm his sole managing conservator. I've raised him from the time he was 18 months old. I've had him his whole entire life. How can that happen? I said, how could he even do something like this? And they said, if you say anything derogatory about your ex-husband, we'll call the police and have you escorted out. Well, I was just weeping. They said there's going to be a hearing next week. If you want to attend it, you can, and if you don't, that's fine. So I was just left with that. I left and went back to Luke's room, and I was just crying so hard I just couldn't pull it together. I just didn't know what was happening. And I didn't even know what a temporary guardian was, actually. And so as I went back to Luke's room, there were big signs posted in the hallway that Susan Mclendon, Luke Forrest Humphrey's mother, in room 204A, has the following visitation hours: Monday, Wednesday, Friday, 10 to 4, and Tuesday, Thursday, 7 to 9 at night. And if she does not follow these, if she does not leave promptly, then call the police. I was just so astounded. I just wept. And I knew that before I went into Luke's room, I had to pull myself together because Luke couldn't see me upset. I went into Luke's room. I called my husband immediately and said, I don't know what's going on. This is what has happened. He called one of his patients, who was Ed Mobley, an attorney there in Longview, and he told him what they told me, and Mr. Mobley began to check into it. He immediately that day filed for permanent guardianship for me in Gregg County.